outbreaks like we've seen at the University of South Carolina and University of Missouri and Washington State University and so on?
Yeah, I'll start. Thank you, Richard. I think one advantage that we've had as a quarter-based university is that we've been able to observe some of those other universities and some of the ups and downs that they've had and try to avoid making similar mistakes. We don't start class until next Wednesday, the 30th. And we've done a variety of things to try to prevent the spread of the virus. One, our curriculum, our in-person curriculum is very limited, about 35 courses out of our 6,000 course fall quarter curriculum. So less than 1% of our curriculum will be in person. We also are limiting dormitory residents, only one student per room in our dormitories, and we're at about 35% capacity in the dormitories. You asked about testing. We have a pretty, I'm kind of excited about our testing technology that we're piloting. It's a very high throughput saliva-based PCR test that will, when it's all up and running, will allow us to test thousands of students, faculty, and staff per day. Our intention is to be testing the entire community once per week, and then doing the appropriate contact tracing when we find positive tests. And we have a whole dormitory devoted to isolation and quarantine. So we have about 400 beds available for isolation and quarantine. Lastly, I'll just mention that we're doing all this in collaboration with the City of Davis and a new program we've called Healthy Davis Together, which we've, in the same way that we collaborate with Sacramento and Aggie Square, we're very interested in being a good neighbor and a good partner with our electeds and our other residents in Davis. And we are hiring about 250 students to be what we're called public health ambassadors, or student health ambassadors, I should say. And their role is to go to their peers and say, remind them to wear their masks, remind them to be physically distant, remind them to wash their hands, all the things we know we should be doing to keep the environment safe. And we think that'll be more effective. The peer interaction will be much more effective than the administration, than me and telling people all the time what to do and being sort of negative. And we have the appropriate policies, and if people are intransigent and don't behave properly, we have the appropriate ways to correct that behavior by limiting access to the campus and other measures. So that's a long answer to your question, but those are some of the things we're doing.
Appreciate that. Dr. Lubarsky, anything to add?
No, I just think that we were just discussing this today. The state is, and this is something that all the health systems are discussing, not just UC health systems. And the state wants more testing. They want more testing being done by the individual health systems in order to, and because we need more frequent testing to allow us to really go about our business. But there's still a supply of reagent shortages. And unless we have things, as Dr. Chancellor May was saying, unless we can really use some other techniques that are not reagent limited, such as this high throughput testing that UC Davis has developed. And again, this is another example of the public university writ large, not just the health arm of it, really leveraging its knowledge on behalf of the health effort. We really need those types of solutions. And we need to move regulatory barriers out of the way in order to employ and then deploy them effectively on behalf of the population, not only just our students, a very important congregate living population, but frankly, we should be testing periodically every single nursing home and home for the the mentally or developmentally disabled individuals where they don't have a choice but to live in a joint living facility. And we need to test people frequently to make sure there are no epidemics inside of those facilities. Same thing with our jail system, very at risk.
Thanks. Well, in a related vein, universities throughout the U.S. have begun to deploy a variety of reopening strategies, some, as we mentioned, more effective than others perhaps, but it seems that there's been no systematic attempts to conduct research on the effectiveness of these efforts. And even within the UC system, with all the attempts at collaboration along many dimensions, I'm not aware of any studies comparing different strategies for physical distancing or testing or track and tracing or isolation strategies between the campuses, and certainly none using strong designs like cluster randomized trials. So I was wondering, why is this, and is there still time for us to start to learn our way out of this crisis?
Well, as for the why, I think it's because we've been assembling the airplane as we fly it. So there really hasn't been a lot of time to devote to some deep thinking and deep studies about the pandemic. As I think now those things, the time is emerging. And I think I mentioned our Healthy Davis Together initiative. Part of that is actually a large epidemiological study of what's happening here in Davis. The research part of that is sort of latter phase of the operational aspects that I already talked about, but we do intend to study the very things you mentioned, Richard, at least in the Davis community. I'm sure David may have some thoughts.
Right. No, I'm really sort of amazed at how little we know. I mean, just nationally about what works and what doesn't work. What we've tried to do, but we do know some things, right? So the public health team is pretty clear around, what does work and what doesn't work. Wearing a mask works. Staying 6 feet apart works, right? Not going to broad-based gatherings with lots of people you don't know. That works. We already know that. And we can see this. Yes, we don't have cluster randomized controlled trials, but we see a bump after every single 3-day weekend, right? Some things are sort of self-obvious. We do our own we can't randomize people, if you will, okay, we're going to keep you together and we're going to then take this other group and separate you, because that would be unethical. I can tell you this, that when we had a cluster of infections among some of our trainees and medical students, we said, how is this occurring? We have all the right rules, but what we didn't have was the right culture. And the right culture was, we will change everything that we do to pursue the safety of the teams that have rounded together in the same way for the last 150 years, right? There's the doctor at top, the faculty member, and there's the trainees and the fellows, and then there's the medical students around them, and they're all in a little cluster. We said, you guys just can't, and girls, can't do that anymore, right? You can't stuff yourselves into a break room, right, with 1 foot distancing, wearing a mask or not, for 30 minutes talking about, because it's not gonna work, right? So, we converted every meeting room we had and courtyards that we had to new meeting places. We insisted that everybody wear masks. When people were rounding in patient rooms, we said, okay, how many people really need to go in there? And how many people can be arrayed at a 6 foot radius and not go in there and not start sharing everybody's germs? And we took, this is all, believe me, it's a big lift to literally change the culture of how we teach in a medical center not overnight, but over the course of several weeks. And we went from 2 or 3 learners having an infection, not from the patients, from each other, to none the last several weeks. So I know that's not a study, but it is a direct result of changing the way that we conduct business. You don't really need a study to know that masks work. I mean, there have been studies that show that masks will reduce dramatically the amount of virus particles that you share. There have been studies that show that a mask will reduce dramatically the amount of virus particles that you inhale or ingest from someone else. So if you both wear masks, the viral load that gets to you is markedly reduced, and the viral load is what determines whether or not you get infected. Sometimes it's like putting the parachute on when you're jumping out of an airplane. You don't need to do a randomized controlled trial whether it works or not.
Yeah. Okay. Well, thanks for that. I'm gonna move off the COVID platform for just a moment and ask you both about a broader issue, which actually does relate to our current crisis as well. And that's that one role, arguably, of elite universities like the University of California is to train elites, at least in the sense that only 36% of adults in the United States have college degrees or have earned bachelor's degrees. Why do you think there is so much distrust of experts, a subgroup of elites, in today's political environment? And what can a public university like UC Davis do to restore trust and expertise?
Well, I can say for sure that's one of the most troubling and distressing trends that I'm observing in our society. I spent a lot of time in my life, and both of you did as well, trying to become an expert in something so that we could lend our expertise for the betterment of the society. And if society doesn't trust us, that's a real problem. As to what we can do about it, I think the more we are embedded and engaged directly with our constituent and stakeholder groups, the more we validate the expertise that we have. So we can't be in our laboratories, in our ivory towers, and never interact with society at large. We have to be out and among people, showing them how, or at least attempting to show how the knowledge that we're creating can provide solutions in their lives. And that's part of the reason for what we're doing with Aggie Square and Healthy Davis Together, and all the interactions that we have with the community is showing, at least locally and regionally, that the expertise that we have is makes a tangible benefit, or can make a tangible benefit in their lives. And I think when you show people, then you build that trust. Now, the larger problem nationally, that's a different issue. And as I said, I'm very troubled by it. I think it's somewhat cynical, and there's an agenda there to reduce the trust in some experts and enhance the trust in people who, in many cases, don't have expertise. But I don't want to get too far off on that in that direction in this particular venue. So.
Couldn't lure you in that direction.
Yeah.
All right, David, do you have anything to add on that?
Oh, you can lure me in that direction. I mean,
Okay.
the denigration of
Please.
scientific experts, right, in lieu of ill-informed, politically driven statements so that the facts are twisted to support a specific political position, is incredibly detrimental to the public health. The lack of role modeling, the lack of deference to scientific expertise about what works and what doesn't work, and the idea that somebody who understands science, that their opinion should count perhaps less than someone who does not understand science, is really troubling to me. This is not about this, because it doesn't matter whether it's the right or the left, this person or that person. It's the general tenor that somehow or other, all that matters is, who has, the attention, and then their voice gets heard, as opposed to who has the facts and the truth and their voice being heard. And, this whole thing with Dr. Fauci, subject of conspiracy theorists, et cetera, pulled in 17 directions. He can't make anybody happy. The man is an icon of the HIV effort to deal with a truly devastating disease. He earned the trust and the gratitude of a generation of physicians and patients. And to see the way that he is treated as almost a political pawn by some people is troubling to me.
Yeah. Well, I have so much else that I'd love to ask you, but I think we need to give our audience a chance. So, Brooke, if you would cancel the recording and let's open it up to our audience. If you recall, we asked that you please raise your hand using the Zoom feature, and one of our center staff will call on you, and then you can address your question directly to one or both of our speakers.